And my guest in the studio today is an expert on treating dementia. He heads a hospital department with a special unit for people with memory disorders. Dr. Bernd Gallhofer, thank you very much for joining us today.
Thank you.
Dr. Gallhofer, everyone's memory or brain degenerates with age. When is memory loss a cause for concern? When should you go and see a doctor about it?
When things are happening in a repetitive manner, you don't just mislay your key once, but many times you mislay a lot of things. The example comes from my psychologist who told me her grandma is a great sportswoman. She's biking to the grocery store day after day after day. However, she's then walking back home, and the next morning she's wondering who might have stolen her bike.
So it's quite distinct, and it happens a lot, that memory loss. But with dementia, usually there are other symptoms beyond memory loss. What are they?
Loss of orientation, mislaying things that you don't find again, where you don't understand that you have mislaid them yourself.
Okay. And then when someone comes to your the special department or the special memory unit, what sort of tests how do you differentiate as a doctor between normal memory loss and dementia?
Well, the first thing is you want the person and mainly also the relatives who are observing the person to tell you what's happened, because many times the person, him or herself, will not be able to tell because they just don't know. And if it's happening in a repetitive manner, grandpa walks out for half an hour, comes back 6 hours later, totally exhausted, maybe brought back by a neighbor who just found him incidentally somewhere in the street, then this is a cause of concern. Okay,
so you asked lots of questions at first, and then you try to establish the exact cause, because there are many different causes.
That's really important. What you then do, the next step would be that you use a sort of basic tests which grossly tell you something is wrong or it's not. The next thing is you go into a medical examination to see whether the damage is happening in the brain itself or somewhere else in the body.
Okay, so those are the two different causes, either in the brain, so that might be Alzheimer's, or what sort of causes could it have in the body, the dementia?
There's a spectre of causes. The most frequent one is heart disease, high blood pressure. Then there are so-called metabolic causes like diabetes or disorders of the thyroid gland.
Okay.
All those things may cause a
form of
peripheral damage that then consequently damages the brain.
Dr. Gallhofer, curing Alzheimer's in mice, that certainly sounds fantastic, but can you put that into perspective? What do these results actually mean for patients with Alzheimer's today?
Not very much as yet, I'm afraid. You have to regard that like a horse race. There's a lot of horses running, but you don't know which one is going to win and which one is going to be still present at the target.
Okay, so a lot of different treatments being researched. Is there one that you would say might be very promising?
You see, we have two signaling systems where we know that they're not working very well. And we have substances that enhance these systems, but you need intact brain tissue, so they are promising in the beginning of the disorder, but the further the disorder is progressing, the less hopeful they are.
That's where early recognition comes, and we'll speak about that in a minute. For now, what sort of treatments are available today for dementia? Just broadly, give us an overview, please.
Well, mainly what you have got is these two substance groups that you can use at an early stage. There's not much more available apart from prevention, early prevention, or treatment in the sense of maintaining the system.
Yeah, so what the patient in our former report did, staying mentally active, exercising, involving the family, does that help? Is that effective?
The data are quite good for physical exercise, really. Physical exercise should, of course, begin much earlier than when the disorder has broken out. And then there's a lot of things available like mind or brain jogging. You can forget about that. It's not helpful. It's just commercial. What you do is you exercise daily functions. And that's very useful.
Okay. Right. So you mentioned early recognition. How important is early recognition?
Early recognition is very important because you can distinguish between Alzheimer's, who really is sort of fate, and heart disease as a cause or diabetes as a cause. If those two latter ones are the causes, then you can stop the disease. Alzheimer, you can just slow down, but peripheral disorders like heart disease, you can even stop or improve.
Dr. Geilhofer, when will it be possible to get such a very, very early diagnostic testing for Alzheimer's?
Unfortunately, not yet. They don't exist. What we now have got is a clinical set of investigations in the shape of tests, which we can use, which will give us a crude measure showing us that something is wrong or it isn't. That's what we can do, and that's psychological tasks.
And are there people that are especially prone to dementia that might consider getting tested once there is a test available?
There's a small group with a genetic variant which has a very high chance of getting Alzheimer's disorder. It's a small group, and there are tests to find out whether you belong to this group or not.
And who should be asking their doctors for these tests?
Families with frequent Alzheimer's disorder in the family.
Okay, all right, so they can ask. And for the rest of us, because there isn't really a cure, you said prevention is the key. Can you tell us a bit more about that?
Well, the cure of dementia really is prevention, and prevention should really start now. What you have to do is to do a lot of physical exercise, eat a Mediterranean diet, avoid alcohol, smoke, junk food. Junk food is very bad. Fatty acids, a lot of glucose, sugar, that's very bad. And live a healthy lifestyle. Sleep enough throughout your life. When you are having stress, have a break after the stress before you accept a new bout of stress. That's helpful.
So stress plays a role. That was also the question from our viewer Navyot Kumar from India. Stress is important when it comes to dementia?
You see, you should activate your brain, and even in old age, you should always remain active. You lose your brain if you don't use it. So lose it or use it.
Okay. So there's actually a lot that can be done to prevent dementia, and that's directly related to the causes. You said there are physical causes like hypertension, diabetes, heart disease. So the idea is really to keep your body healthy to prevent dementia. Is that correct?
Yes, go to regular checks, see whether you're healthy or not, whether there are things that are preventable. Hypertension is a silent disease. You don't notice that you have hypertension until your doctor tells. Okay,
but thank you. That leaves us with lots of hope, because even there might not be a cure as in a pill, there's lots you can do to prevent dementia.
Exactly.
Thank you very much for being our guest today.